As you go through the readings, you are going to encounter certain terms, and depending how much exposure you've had with scientific research, you may find them some of these terms are easier to understand. Some you may need to require some additional information. So this lecture is to give you some guidance of some of the common terms you're likely to see in the readings and in the videos and other course materials. So the first, and because we're looking at scientific research and how technology can increase or augment public health, we're going to look at different type of studies throughout the 5 week course. And the first type of studies are assessment studies, and these studies are basically what the word says. It's basically assessing an individual or group of individuals, basically collecting data that can be used, for example, to inform some type of program. For example, collecting data on how to develop a physical activity program for older population that are age 60 to 70 years old. So what you would do is assess, giving them some assessment, and collect that information to help inform intervention studies. For example, assessment studies could be basically assessing people's attitudes on climate change. So the whole purpose of these type of studies is to collect information. Um, and these type of studies, assessment studies, can be just one-time cross-sectional, where you just talk to a sample, you assess, or participants complete a survey at one time, or you meet with a group of individuals and you conduct a focus group study, which is a qualitative study where you get people's opinion on something and you collect data at one point at a time. Versus longitudinal, you are doing it over several times and over a period of time. It could be like you want to see if opinion about climate change changes over the course of 12 months. So you might, conduct your assessment on the same group of people at several time points. Intervention studies are different because you are intervening. That's what intervention is. You're intervening on a behavior. You are, for example, a researcher, smoking cessation researcher may want to test the efficacy, which I will explain later in this lecture what it means. The efficacy of a new patch, a smoking cessation patch, in conjunction with psychotherapy, to see how helpful it is in helping smokers to quit and remain, uh, you know, and abstain from cigarette smoking from long term. So the intervention is that you or the researcher is manipulating something. So if you're intervening, you're assessing something that you are exposing participants to. And the goal of it is to promote change or improvement, overall functioning and health and mental health. Interventions can be clinical trials. In clinical trials are basically looking at various effect, whether it's a new medication, as I mentioned, a new smoking cessation. You are looking at the intervention effect. You're evaluating a potential effect. Not all interventions, not all clinical trials result in effect. Some of them we've seen, and we'll see during the course of doing throughout the course, that some interventions don't produce effect. Although the researchers may have wanted to explore, okay, how is this intervention, how is this program going to impact health outcome, and that they see, okay, it did not produce the intended effect. So the goal in understanding intervention is that you are exposing participants to something. You are controlling a certain program, a certain intervention, whatever it may be, that is being introduced, being assessed, and being controlled. And there are different types of clinical trials. There's randomized clinical trial where people are being randomized to one or two groups or many groups based on some randomization procedure. And you will see that in some of the studies that we cover this week. You will cover week one and throughout the course. I mentioned earlier the term efficacy. So efficacy versus effectiveness. Unfortunately, some studies, those terms are used interchangeably, although they mean different things. Efficacy basically is more so looking at outcome. So you have a program or you have a medication, you've given it to a group of participants compared to a placebo, and you want to see, does this medication is supposed to control, migraine headaches, does it work versus, some other medication or a placebo, which is really, it's not a medication. You just tell people that it's just a medication. You want to see, okay, if you have two groups and you have your research lab and you have these groups take these medications in your research lab and you observe them for 7 days or 10 days, you're really looking at whenever something is really controlled, you're looking at um, efficacy, because it could be that the environment where the participants are in, it's very soothing, there's nice music playing, so because they're not interacting with others, so their stress level is probably lower than it would be normally. So there are a lot of things that you are controlling for that, may impact, or may confound with the effect of the medication. So in that context, efficacy or outcome is within a controlled environment versus effectiveness. And with the same example, you're giving people, this medication, but they go about their lives, and you're seeing, okay, as people go in through their lives and engage in their daily normal activities, how does this impact their migraine headaches? Or a behavioral intervention, it could be, okay, as people, for a behavioral intervention, for, let's say, cognitive behavior therapy. Basically, cognitive behavior therapy is looking at cognitions and behaviors that may serve as risk factors or as maintenance factors in smoking. So you're looking at those, or you're also looking at those who are facilitators of change, who can help people overcome urges to smoke. So you can see, okay, as for 12 weeks, if you give people, 30-minute sessions of an intervention, how are they doing as they go about their lives? So that would be an example of looking at effectiveness, because it's a real world environment where the researcher really does not have a lot of control. So how researchers determine significance, the effect, or an outcome of a study, typically for a number of years, so many years, until recently, with the past 10 to 15 years, it's been based on statistical significance. And statistical significance is basically seeing, okay, what you're seeing when you compare two groups and you give this intervention, or what are you, does one supersede the other? Does group A, perform better than group B? And the threshold or marker for determining that is statistical significance. Typically is at p at 0.05 level. However, that standard, as many of you may know, is being criticized. So in addition to statistical significance, what we look at really in the literature is effect size. And you're going to see this throughout your readings, is really what is the effect size of this intervention. So we don't look at only significance because statistical significance, because we know sample size, amphlete, inflate rather um, statistical significance. So you may have an effect size, meaning your association between two variables is very small. However, when you look at the sample size, when you have a large sample size, it might make a significance of 0.0001, where actually the association between your variables is actually practically pretty small. So effect size is another way. It's a recommendation for assessing group differences or effect of a treatment in addition to statistical testing. In other terms, you will see as you read the articles and other materials is our confidence interval. And confidence interval is basically because when we're studying any specific population, whether you're studying young children with autism or you're studying children with type 1 diabetes, you can't really study the whole population in your study. You can't do that. So what you do is you take a sample of that population, a sample of children 10 to 14 who have type 2 diabetes. So you take a sample, and the procedure of taking a sample that's representative is something I'm sure you've gone over in your statistical class, method and design, research design. But as you look at the sample you are studying, one way to determining whether the sample actually you've drawn is real, does it's representative to a certain degree of the population. It's basically we do that through the benchmark of confidence intervals. So effect size and confidence intervals can take some more time to really understand. So it may require that you look into different resources. YouTube can be a really good starting point to really show you what effect size is, but it may require other things like articles to really break down what they are. I recommend that if you're finding the topic, if finding that you need more information on this topic, that you look at these resources and others that might be also relevant, because you are going to see these various terms, and it's important that you're taking the time to understand them, because it really makes it easy to read the articles. The articles are very easy to read. However, as you may know, that scientific articles, there is an assumption by the writer that certain terms the reader understands. So an author is not going to define what an effect size is or what is statistical significance or intervention studies are, because there is an assumption that the reader knows it. So I look forward to meeting with you on Wednesday, and have a good one.